Yeah, thank you for the organizers inviting me here to provide this speak. So it's a great honor. And yes, Vicky, that's true. Nurses are the biggest profession working in the NICUs. And if I tell something about my own background, so I used to work as a neonatal nurse in Finland for over 10 years. Then I moved to the university side because unfortunately in Finland we cannot have divided role in nursing. So I have to either choose work at the university or then in the clinics. So I have been now over 15 years working at the university side, and there I'm associate professor in nursing science. And I have done some research in US and also in Sweden, Uppsala. I have learned a little bit about global health, but the last presentation about KMC was amazing. So thank you for that. Yeah, nothing like that. Yeah, what else would be important for you to know? Maybe that what I'm going to present you today is my biased view, how I see that what has changed in nursing in recent 10 years. So I'm happy if you are against my views, but this was something that I came up while thinking about this shift in landscape. But I say that in the beginning, not in neonatal nursing, but in nursing science, the biggest topics at the moment, they are sustainable healthcare. And also if we look at for more like a global context, we also talk about planetary health. And then of course, digitalization and artificial intelligence are big things, what we try to learn more. And what I will come in the end of this presentation is the lack of nursing workforce. So that's a big question for us. But I want to start this by poll. So I ask you to write down, this will be a word cloud, that what have been the major changes in neonatal nursing from your perspective. So then we can see if we are something, share some thoughts. Okay. I definitely see some similarities with my thinking. I don't know if it's a good or bad, but anyway, encouraging. Yeah, so nursing shortage seems to, yeah, maybe yeah, I gave you the tip, but probably because you are working there, you know. Yeah. Uh, Need gap, individualized care, more focus on pain relief, task focused. Yeah, it can be when you are in rush and no staff. Kangaroo mother care as well. And it started also from the advanced nursing practice and advanced skills, more autonomy, computers. Wow. This will be saved somewhere. Yeah, great. And yeah, research focused. Yeah, as well. Okay, so maybe we move on and you can keep this in your mind, but I see that I probably am going to talk about quite similar things that you were thinking about. So my suggestions for the sort of biggest things that have come up in NICUs in recent 10 years is implementation of family-centered care. Family-centered care in itself is not a new thing. It has been around maybe 20 years or more as a concept, but now it has been really implemented through systematic programs. So that's one big change that I have at least seen. And then I also think that the single family rooms they have changed quite a lot. They are not everywhere, but they are coming up. And when we have, or families have own room, it changes quite a lot for the nurses' workflow. And it also enables many new wonderful things. You also mentioned technology, and that's also my research interest or one of them. So we can talk about wireless, less invasive monitoring, but I think where the focus is now moving on more is the remote care. and home care. So some words about that. And it was a small, but anyway, there was a hint about research interest. So also evidence in nursing is increasing. And I don't know if it's that nurses are highly educated, but that's how it's supposed to be. Maybe that's my claim, that our current care is that demanding to provide that we would need extra resources for education. And then, of course, the nursing shortage. So it has become evident in recent years, I think, in many countries, and it will definitely influence on how things will evolve from now here on. Okay, so now my thought in this presentation is go through all those 6 points with some of my thoughts. And if we start with the implementation of family-centered care. So I think in recent, what would I say, need gap has been here for a long time, but there are many new programs coming up in recent 10 years, like FICARE, FINE program, which has been connected to need gap at some level, family nurture intervention from Martha Wells from US. And then the program that I have been working most with is the close collaboration with parents training program. So that's my experience where I come from. But many of these programs, they are aiming for the same. It's a culture change in providing care within the multidisciplinary team. And I think there are many definitions of family-centered care. And the one that I provide you with today is one from the European Standards of Care for Newborn Health Project. And they have, the parent organizations, they have named this infant and family-centered developmental care. And the infant comes from that perspective that that's the center of all the care. And that also it has the developmental care that is focusing on the infant. And these standards, they were launched 2018, and now they are under revision. And this infant and family-centered developmental care, has like 10 different items. And I would say roughly that those first 4 ones, they are talking about zero separation, that we should do all that is in our hands to avoid separation between parents and babies. So parents should have continuous access to their baby. We should foster bonding, skin-to-skin contact, and also that the environment is such that the parents are able to be there with their baby. And then the next 4 ones, they are related to parents as or parenting, if I would say. So parents are the primary caregivers, and they should receive a lot of support from staff because they are in a new situation in their life, and we should provide them socioeconomic, mental health, and spiritual support. And also that we have to plan together with the parents the whole care from birth until discharge. But what I want to highlight from the nursing perspective are these 2 criteria or items. So it's also in this sort of what you call this standard that you have to provide formal education and recurrent training for the staff. And I think that's something what I want to highlight, that it's not something that provide family-centered care. It's not based on your intuition. There is clear procedures how to do it and what kind of skills are needed. And that doesn't come from the heart, it comes by training. And also the other thing is that it's also emotionally, how I say, demanding for the staff or nurses to work with the families all around the clock. So they need also counseling and regular clinical supervision. So also staff needs support. And I would like to highlight these 2, that these are sort of the shifting landscape in family-centered care. And something more. So I think also within the family-centered care, there has been a great movement of parent empowerment. And the one big thing is, of course, EFCNI and Silke Marder and her team and all the European-wide parent organizations in different countries that are like having a more visible role in caregiving, or their voice is now more heard. They are influencing in different conferences and contacting policymakers, working together with researchers and staff members. So I think that has been something big, what has become in recent years. And then also because of the family-centered care approach, so our role as a nurse is it has changed from caregiver to a facilitator. And I must say that based on research, what has been done, it's not always an easy shift. So because nurses have used to done hands-on care or provide hands-on care, but now they have to step back and let parents be the parents. And what are the new ways of sort of facilitate that process of becoming a parent in an NICU environment. And it at least requires a lot of advanced communication skills. You have to learn how to negotiate, how to handle conflicts, and be in open communication. And that has been highlighted in close collaboration in parents training program. But I think there is also a nice way to learn to talk in a little bit different way or discuss with parents. It's in Alberta Family Integrated Care, and Karen Penzies is the professor in nursing who is one of the developers of this program. So this is something that we have to learn now to be better. And also we have to remember that diversity, equity, and inclusion are an important element of family-centered care. So that's why we have to now more and more understand and adapt the care that we are providing based on the cultural needs of each family and parents. And I think we need more knowledge and training and supervision. And also, I think the concept of family has increased. In family-centered care, it's always decided by the parents themselves who they want to be involved in the sort of family, who is their family. But for, I think, many families, it means at least siblings, what's their role in the NICU, and significant others. And there we are talking about like grandparents, friends, or whoever is the important person for the family. And there is now coming more papers about the role of significant others. For example, in the study that we did in Nordic countries, it was clear that also the significant others need support. But at the same time, they are very important social support for the parents themselves. And if we think that now we are incubating families, parents with their babies in the NICUs and single family rooms, so we have to make sure that we are not isolating these parents from their social context. So that's why I think more research is definitely needed on there. And it's also came up in the parent interviews that they need their privacy in the beginning. So it's not only that the significant others need help, but that also parents want to be alone, at least in the beginning, and really understand what has happened to their family. So some shifts. So definitely nurses need new skills and like communication skills, more cultural competence, and understand how to work with siblings and significant others together with the parents. Okay, if I then move on the single family rooms, and I know that they are not the current practice everywhere, but they are coming up, and it doesn't need to be a room, but you can still do a lot with the environment and parent bed to make some of these things possible. But I think that with this movement, now the home comes to the hospitals, and now we have to negotiate the home rules in hospital. That at least what I have been following in a couple of NICUs where I have visited frequently. And one thing that have come up at least is family privacy versus infant nursing care. We just conducted interviews with the parents in our own unit in Finland with single family rooms, and we asked from parents that how is it be in the unit for 24/7? And they brought up that it's a quite a hectic place, that they don't have privacy. You have to be all the time in sort of alert state. Anyone can walk in the room, and it's happening several times during the day. And it's not only nurses, but other staff members. And so they said that it's not always so great. On the other hand, when we discussed about these findings with nurses, and it also was parents' perception that, of course, nobody comes there without reason, but how to sort of negotiate this bigger puzzle that there is still privacy for the parents and still that all the care and support is provided to the family. I think that's one thing that we are handling at the moment. And also, what came up already in the last discussion about being or providing kangaroo mother care for 20 hours or being somewhere in 24/7. So how to make it happen? So it's always a balance between your home environment and this hospital environment. And in hospital, you are sort of isolated where you used to be. But at the same time, the biggest need for parents is to be with their infant. And it's also infant's right to have their parents with them. But on the other hand, there are siblings, older siblings at home who require parents as well. And also there is something calming and sort of making you feel better when you go home and do your normal things back there. So how to balance that? And I don't know what's the good answer. I think from my perspective and what I have thinking about this based on different findings, we have to negotiate that with parents. We have to support them to be in the unit as much as possible. But on the other hand, we have to consider what are their limitations and what they are able to do at certain points. Then the third point, I think immediate skin-to-skin care and couplet care are the concepts that have now come to the NICUs. And one thing is because there are more single family rooms and privacy also for the families. So now it's turned in the direction that we are also aiming to provide immediate skin-to-skin care, even the very smallest babies. And there are a couple of papers out there, and it's doable and safe, but we are not quite exact about the current limit of gestational age. And also couplet care is something where nurses have to very smoothly collaborate with midwives in the mother's care during the couple of first days of after the birth. And these are big concepts. So this requires extra staff training. So what the nurses have to look from the mother that they know when they need midwife, or is it better to train the nurses to have some midwife skills or midwives working in the NICU? There are different ways to do this. But anyway, it requires standard procedures and it has to be safe, both immediate skin-to-skin care with extremely preterm babies and the couplet care. But anyway, zero separation is here as a concept, and there are many ways and sort of good study findings that are encouraging us to move on that direction, but it still requires work. Then the third point about the technologies. So that has been my personal interest since 2000. What was it, 96, when I started to work in an NICU. I was very interested about ventilators at that time. And then I did my PhD about pain management and sleep. So somnopolygraphia was very interesting and it is still from my perspective. And that's why probably I have also continued the research in that area. So currently, I'm in a project at the EU level where we develop remote monitoring and for babies and mothers. And the idea, as in general, is now to move more care from hospital to home. And in this project, we are developing a smart bed where you don't need any attached sensors to see the baby's physiological parameters, and also the mothers that they are having different kind of belts and equipments that we are able to follow their health and also the fetal health. And these technologies, they are part of it, but they have potential to improve the workflow, that we don't have to necessarily isolate the families in the hospital if that's not necessary for the safety, but maybe we are able to move them early to home care. But there they need also this technology that we know that the babies are in safe. And also it's a lot about telehealth, that how to communicate immediately if parents need something, or do we have a regular medical rounds at home, or what's the best way to conduct care at home. But anyway, there is a movement that home is the best environment for the whole family. Those studies are done from Denmark, but I know that there is the same kind of ideas and movements also in Sweden, and I'm part of some of those research projects at the moment. And then Philips is one of the, I would say, the leading company in making the monitoring for the maternity and infant care. And those 5 pictures, they are from their sort of, how would I say, marketing things. So they are patient-centric, consolidated, ambitious, I don't know how to say that, but anyway, that's shifting care from hospital to home. It's digital and value-based, that everything has to provide value to the end users. So anyway, I'm just thinking that is it industry that is shaping nursing, or is it the other way around? I think it's important that nurses and all the people who are working in the NICU, and also parents, of course, that we are part of the development process of this monitoring or whatever digital devices, that they are made such that we need them and they are going to be used. And what data is actually something that needs to be provided for the parents? Do they need that? And can there be too much monitoring? I think, but these are the questions that have to negotiate together with the industry. But it's clear that providing more data and interacting digitally with the families, that empowers the parents as well. So there is a potential to improve the engagement of the parents. And I think that when this care path or workflow through digitalization, it starts from the maternity care, and I don't know, ends at the school age in the end, or when end of your life. But anyway, these kind of solutions, they have potential to increase the continuity of the care. But now I just want to check that, is that what I have been talking? Do you share any of these experiences, or is this something totally different, how you feel that the nursing has changed? Good. Excellent. So it's partly and no. So I think that's very interesting thing. But it seems that half of you think that this is something what is currently happening. But let's go back to your experiences in the end of discussion. So I want to hear more of those, that what you think is going on. Then I would like to move on the evidence-based nursing. So it's happening in all fields of science, that there are every day coming up many papers on research. So it's also happening in nursing. And this is just a very sort of, how would I say, simple search in PubMed, what I did for this presentation. But if I just put in words, nursing and NICU, so there were 5,500 papers. And if I put medicine and NICU, so it was 11,000. So of course, there is still more research in medicine, but you can see that it's also accumulating in nursing science. And so how to make use all of this information and new scientific findings. So there's a lot of research. What are the effective family-centered care training program? I already mentioned those and a couple of more. So that's in the focus of nursing science. But I would say that these programs, they are studied in multidisciplinary teams, as most of the research is done currently on these days. So it's not only something with nurses, but the whole multidisciplinary team. The other nursing research topics were family-centered care as a general, breastfeeding, pain management, prevention of infections, discharge, how to plan that, parental mental health, and palliative care. And I think at least a third science that is heavily involved in these studies is psychology. And if you make this same search with psychology and NICU, I received over 3,000 papers. So that's what's going on there. And many of the work around parental mental health is done in collaboration with psychologists. But I think the big question is here, as I started to explain, that this data is available or research finding. So how to support this implementation, because it's not any of help in the PubMed. And I think here we would need a strong nursing leadership, because nursing leader is the one person who is can be responsible of the implementation of evidence in the NICU. So I think that requires more work, and it's shown in several research or in studies, also in Finland, that it's not happening, that it's a lot of still intuition and old practices that nurses are working with. So we need some extra research. Maybe implementation science is also going strong in nursing science, but maybe we need that also in the NICU context more. And also, I think advanced practice nursing, they are nurses who have master degree or above, maybe PhD, who are working still in a clinical environment. So they are the key persons who can help nursing to make use of all these important findings. I have been also thinking that AI is maybe one solution, because now already ChatGPT is so good. We all know that we have to check the resources and references, what that information is coming. But currently we are developing an algorithm which checks that where this information is coming from if you ask something related to your health. So I think in a couple of years, this will help us more, that you don't have to go through all the papers yourself. And there is, of course, reviews available, but that will be, I think, digitalized quite quickly. But I think computers cannot make it all, because we have to be critical in thinking also nurses and be able to argument how we work based on evidence. So there is definitely a requirement for more education for nurses. So the advanced practice nursing, which can be two main, titles are nurse practitioners. They can be neonatal nurse practitioners or then clinical nurse specialized. So they have master degree or PhD, as I said, in nursing, and there are special programs, of course, for neonatal nursing as well. So those can be one answer. They are common in US, Canada, and UK, not that much in many other countries in Europe. I think Netherlands is something that is coming up. But there are also master education in neonatal nursing in Norway and Ireland, and I'm sure in many other countries. In Finland, it's arranged so that there are extra courses after your bachelor degree. So you learn in the hospital more about specific care provided in a NICU. But I think this should be more systematic. And of course, when you have more higher education, there is expectations for career development. And that's not going well in nursing, I would say. I would like that there will be more career path, more you know, more you get responsibilities, and also opportunities to develop your own work. And of course, better salary as well. And then I also think that what should be in education in all professionals should be the multi-professional approach. That because we are a team, it includes parents, midwives, neonatologists, psychologists, physiotherapists, occupational therapists, whoever are working with these families. So there should be focusing on team building and how we collaborate together. Okay. Then the last part about the nursing shortage, something about it very shortly. So it has been described currently as the worldwide shortage of nurses needs to be considered as a global health emergency. That's the quite rough words to use there, but WHO have estimated that we need 9 million more nurses and midwives by the end of 2030. So it's a quite amount of nurses. And International Council of Nurses, so their association said that 20% of these associations have reported that more nurses are leaving their profession. So it's not only that we don't have new nurses, but those who are still working on the field, they are leaving the job because it was not what they expected. And some reasons that have been brought up and studied is that we are aging population, so they or people, me as well, soon need more care. And we all become older, also nurses, so there is less workforce. So that's one reason. This leads to inadequate staffing and stress, burnout, all that cycle. And low salary is the one known fact, and poor leadership. And there we talk about nursing leadership, that it has something where we at least have aim in our university to focus on more, how the actual head nurses can support their staff to stay in the NICU. And it's one also common reason is that there is a quite hierarchical relationship between doctors and nurses, and that's not always increase your willingness to work in the NICU. But these are some of the things. There are many, but I would like to ask your thoughts. What kind of solutions you would have to the neonatal nursing shortage? And I don't know, maybe even the first question is that even reality in your unit? But if it's so, how would you try to solve that? Oh. So you are at least voting for better salaries, improve and team culture is big. Yeah, better work condition, respect, recognition, political engagement. Yeah. Yeah, I think extremely good treatments or medicine for the nursing shortage. And I think this can be also one sort of warm up in the afternoon panel. So let's keep this in mind. Okay, so thank you. That was my talk part. And now I'm happy to answer any questions you may have.